Hello, everyone, and welcome to Fibromyalgia Awareness Program. In this podcast, we will be discussing about fibromyalgia, the condition which is unknown and underdiagnosed. Fibromyalgia is basically a chronic widespread pain. But no, I am not the right person to talk about it. For that, we have a very renowned pain specialist from Mysore, Dr. Pratibha Matche. She is associated with JSS Medical College, Mysore. She has done a lot of work and treated multiple patients with chronic pain conditions in her clinical practice. Ma'am, thank you for joining and welcome you.
Yeah, thank you, Jennifer. It's really a pleasure to be here and especially talking about a condition which is not much discussed and not much known to the general public. So, thank you so much.
So, ma'am, to begin with, wanted to start with what is basically fibromyalgia and what are the common signs and symptoms.
Yeah, so fibromyalgia, first of all, I would like to tell that this is one of the condition which is not much diagnosed. There is not much awareness about this condition. And this is a chronic pain condition which has widespread pain, means patients will have pain all over the body. There is also, fatigue, which is predominant symptom in patients that most of the times patients will feel that I'm eating well, I'm doing all my routine. But in spite of that, with the small activities also, I feel very exhausted and I want to lie down. I don't feel active. Another thing is a sleep disturbance, that they are not able to sleep, or if they sleep also in the morning, they are unrefreshed. Most of the we as normal people, when we get up in the morning, we are fresh. But it is very unfortunate that these people always have an unrefreshed sleep. Another condition that is very bothersome or another symptom is the mood disturbances or mood swings. They always feel very low, always anxious about it, and they also suffer from depression. They also have a cognitive dysfunction, which is very commonly called as a fibrophobia. That is, patients are not able to concentrate, they forget things, and they feel very embarrassed with all these things happening in their life. So these are the common symptoms that are present in the patients with fibromyalgia. And also they have, a lot of stiffness all the time. They feel that the body is under tension. They are never able to feel relaxed. So these are the conditions, and it's a chronic pain condition associated with all these kind of psychological disturbance, and that's the reason why most of the times they are labeled as having psychological problem. Nobody believes that it is a disease and it is a condition. The family members also, they feel that we have shown to everybody. Maybe I think they always, most of the patients who are listening, they will have heard these things, that maybe I think it is not real, it is in your head, or maybe you should consult a psychologist. Maybe you are overthinking. So these are the things which mostly people will hear when they are suffering from this.
So, ma'am, one very common with associated with fibromyalgia that it is not curable. What is your suggestion or what are the facts behind that?
So definitely, I would say it is a very strong myth, and unfortunate that people do believe that this exists. Fibromyalgia can definitely be managed. There are a lot of things which can be done, especially at a patient level themselves. That is the lifestyle modification. So the most important lifestyle modification that is required or that one should adopt if you are suffering from fibromyalgia is the exercise. So the EULAR guideline says that the exercise is the strongest recommendation. So if most of the people, they will want to undergo, the advanced treatments like medications or some type of interventions or some surgeries they may be thinking. But the most strongest treatment or management in fibromyalgia is the exercise. So this exercise can be in the form of aerobic exercises. Most important is the strength training or aquatic exercises like swimming, or even the daily walking, the persistent walking. So these are some of the exercises which can definitely make a huge difference for patients. But one of the recommendation I would like to tell is that you have to start low and go slow. If you are already suffering with a severe pain, then if you are more over enthusiastic, then this can exaggerate your pain, and that may discourage you from doing these exercises. So you just have to remember that you have to be persistent, and however your body, you listen to your body and do as per your body tolerates. But you have to be persistent. Definitely, it works very well. Then another thing is you have most important thing I would like to say is the patient education is one very important thing in the management of fibromyalgia, because not only patient but whole family, you have to involve the whole family so that they know that this is a real condition. This is not just that the patient is making up in his mind, his or her mind, but they are suffering from a serious problem, and you have to believe in them and provide all the help that is required. So patient education and reassessment at a regular intervals is very important. And along with that, these are the patients who really suffer from a lot of mood problems and catastrophization. That means they exaggerate things, whatever is happening to them. So to cope up with that, definitely we can take a help of psychotherapy. Cognitive behavioral therapy is supposed to be really helpful in these patients. And another important thing would be to have the groups and talk to each other and what is working, because each patient has a different symptom which is predominant. So you have to understand that what should be treated. So definitely the patient education, the psychotherapy, and the exercises, as I told, exercise plays a very, very important role. And also like some form of myofascial release, trigger point injections, if you have the muscle knots, also helps in the management. Some of the drugs which are have been recommended.
I think fibromyalgia has associated with brain, body, every organ of the body. Most of the time, the pain is there, psychological symptoms are there, even though it is impacting the lifestyle or the quality of life of patient. So, ma'am, what are the
Yeah,
reasons?
it significantly affects their quality of life.
Yeah. So, what are the reasons why fibromyalgia happens?
Yeah, so fibromyalgia usually, though they have a widespread pain, there is no problem with their muscles or joints.
Okay.
If you do their MRI, if you do all the blood investigations, everything will come normal for them. But this is basically called as a nociplastic pain. So they don't have any visible damage, or there is no visible problem which is there in the body. But there is a problem with the nervous system. That's called as a nociplastic pain. And there is also an sympathetic nervous system activity which is hyperactive all the time. So, for example, if I tell you that all of us, when we are doing a normal routine life, we are relaxed and we are having our own time, and we enjoy the life. We don't feel any kind of stiffness, pain, or mood disturbances or anything that is happening. But suppose if we are also put in a condition where it's a fight and flight mechanism. Like suppose if you see that there is a fire, you are going on a road and you see a fire. So suddenly you get alert, and you will have anxiety. Your heart rate will increase, body becomes stiff, and you will start running away from the place. So imagine this kind of thing happening in a fibromyalgia patient throughout their life. So that kind of an alert condition happening to you all throughout life is something that happens. This is the cause. There is an hyperactive sympathetic nervous system. They also say that there is an involvement of fascia. The fascia is a connective tissue which is covering the muscles. So that has a lot of nerve endings. And this also causes, severe pain and stiffness in the body. So there is no problem with any organ, but it is a basically nociplastic pain associated with the, we call it as a central sensitization. So that's the cause. But in these patients, these are the patients who also can have, these are the some of the risk factors which we can see in patients is like patients who have hormonal changes, patients who are suffering from psychiatric disorders like anxiety, depression, patients who have IBS, or patients with these cognitive problems. So these are the patients, migraine, tension headaches, all these people who are prone for fibromyalgia.
Right, ma'am. So, ma'am, like you mentioned, there are multiple signs and symptoms, and this is basically a neurological condition, a muscle related issue. So, how do a doctor diagnose this condition if the tests are normal? And how a patient want to evaluate themselves, screen themselves, if I have fibromyalgia or like condition, and I should go and consult a consultant? What is your viewpoint and what are those line items?
So I have told you that most of the blood investigations and MRI, CT scan reports will be
Yeah.
normal in these patients. This is basically a clinical diagnosis depending on the symptomatology and some of the physical examination. That is what will decide the condition or diagnose the condition. Unfortunately, the research has said that for the fibromyalgia to be diagnosed, it takes more than 2 years for the patient. And they would have consulted 3 to 4 doctors before it is diagnosed. So it is very unfortunate because there is not much of awareness amongst the patients, because patients feel that this is, they feel, they whatever they feel, I don't know, but mostly people make them feel that there is no problem with you. They know that there is a problem, but mostly people around them, because everything is coming normal, physically there is no problem with them, they look perfectly normal from outside, why they are suffering so much? So that's the reason why it takes a lot of time, and mainly because the investigation doesn't show anything. And many a times, even in the medical fraternity, there may not be much awareness amongst everybody about the fibromyalgia condition. So it takes a lot of time, but it is definitely diagnosed by only history and clinical examination and the symptomatology. So which we have already spoken, that there is a widespread pain. They don't want, even the normal touch is painful for them. So I would like to share here that one of my friend who has a fibromyalgia, she said that when her daughters come running and to hug, it's painful for me. So it is very unfortunate that they have that extra response, or their extra sensitivity to pain. They are not able to sleep, or even if they sleep, the morning there is an unrefreshed sleep, and there is an excessive fatigue in them, and they always have a mood swings, and there is an poor concentration, or they are not able to remember things. So these are the predominant symptoms which are found in the fibromyalgia patients. And when you touch the patient, there is tenderness. You have, on examination, you will find that there are muscle knots or the trigger points which will be there. So this also, these are the some of the signs which you can see in these patients. So basically, fibromyalgia is a misconnection in the multi-connected world, you can say.
Yeah. Yeah. Right, ma'am. So, thank you so much for enlightening us on this condition and breaking the myth that it is not treatable or it is not curable. Coming from you, that pain management can be done, and this fibromyalgia can be easily managed with pharmacological and non-pharmacological. And one more important thing you mentioned about the patient awareness about or education about the disease. So, I think through this podcast, the listeners would understand the condition, and it is manageable if you get proper treatment from a pain specialist or consultant who is treating this condition. So I think this podcast will be very helpful for the listeners to understand and get themselves treated as soon as possible. Thank you so much, ma'am, for joining on this podcast. I think it was very lovely talking to you.
Yeah. So to conclude, I would say to all the people who are listening that I want you to believe that the fibromyalgia is not something that is in your head. It's a myth. It is actually real. And believe me, you are not alone. To definitely stay active, do your regular exercises, take help of the multidisciplinary management, and it definitely can improve your quality of life, and it is manageable. Don't think that because you have fibromyalgia, the world has come to the end and you can't do anything. It is 100% manageable. You have to consult a proper multidisciplinary team for getting your problem solved.
Thank you so much, ma'am.
Thank you so much.